Health systems can only function with health workers. Improving health service coverage and realizing the right to the enjoyment of the highest attainable standard of health is dependent on their availability, accessibility, acceptability, and quality. A projected shortfall of 18 million health workers by 2030 in mostly low and lower middle income countries is not the only challenge ahead. There are other varying difficulties, including educating, employing, deployment, retention, and performance of the available workforce. Research conducted in various countries has over time shown that human resources for health information systems are often weak to take stock of health workers from the public sector. The shortage for health workers is a global challenge, especially when it comes to specialists in the different medical fields, and Uganda is not exceptional. For example, Uganda has 6,524 registered health workers. Whereas this may seem a big number, it's just a drop in the ocean for the 2 national referral hospitals, 4 specialized hospitals, 13 regional referrals, and over 30 general hospitals in the country. In fact, the country is short of more than 20,000 health workers and has less than 30 specialists. During the Merck Foundation Africa-Asia Luminary Conference in Ghana, First ladies from selected African countries were urged to change such statistics.
But your aim really is to serve your country, and you do it with the means you got through your elevated position. And that's something very, very special, because it's not normal. And as I said yesterday, this institution of the First Lady, and of course, joining First Ladies, you are creating far more power in it, because we all need strength, and we get strength from other people as well.
Uganda's representative, Sarah Opendi, who is the State Minister for Health, says government has put forward several interventions to especially retain health workers.
We are actually looking at ensuring that the human resources for health that we have attracted back to the government facilities as a result of the increment in the salaries of these doctors, we want to ensure that they have the necessary equipment, the necessary infrastructure so that they can be able to work. The government of Uganda, with a grant from the Netherlands government, 23 million euros, which government is supposed to match, is going to equip all the regional referral hospitals with the necessary equipment, but also we are trying to conclude another agreement with another organization, the General Electrics, to equip all the general hospitals in the country with the equipment that they need, and also selected health center force.
The World Health Organization has set guiding principles on global strategy of human resources for health, including a promotion of international collaboration and solidarity in alignment with national priorities. And this is the focus for the Merck Foundation in Africa.
We look at the needs of each country and the geographic scope of each country and the population. And we divide the opportunities according to these 3 factors: the eligibility criteria of the candidate, the population of each country, the number of specialists already existing in each country, and then with making a small equation, we come up with availability and available places.
We had just about 8 oncologists, those treating cancer in the government facility. The number has since increased. Government has put in a little money to train more. And of course, Merck has trained for us 5 oncologists, and more are coming on board.
The agreement that we sign with them is that the person they train must commit to return and work for the country.
The government program, together with the Merck Foundation programs to skill specialists in key areas that we are sending people for medical tourism, cancers, heart disease, and all that, enabled us to acquire the skills necessary to treat these diseases locally at home. Now, one of the challenges is that when many of these people have come back home, they have found themselves now without work, because the system has not been geared towards employing that cadre of specialization.
By 2015, the doctor-to-patient ratio in Uganda was estimated at 1 doctor per 24,725 patients and 1 nurse to 11,000 patients. The World Health Organization recommends 1 physician per 1,000 people. It is hoped that if the guiding principles of the World Health Organization are considered, countries will make remarkable improvements in their healthcare systems. Walter Mwesije, NTV.